Hello, my name is Ameshia Latham, and I am doing my drug summary presentation on over-the-counter analgesics. Um, I will be using over-the-counter pain medication. Um, I'll use that also as a substitute to saying over-the-counter analgesics from time to time. So just FYI. All righty. So here at my table of contents, I will be going over the purpose of over-the-counter pain meds, a brief history and the origin of these over-the-counter analgesics, the different types or the common types of over-the-counter pain medication. And I'll go over some of the special population concerns, as well as toxicity, signs and symptoms of overdose, as well as treating an overdose. All right, to start off, the purpose of over-the-counter medication would be, in general, to control inflammation, as well as to control mild to moderate levels of pain, and also reduce fever. Pain is subjective, so it depends on what you feel like pain would be. That could be cramping, it could be joint difficulty, it could be a variety of things. And this is one quote out of the text that I felt like it was pretty relevant. 70% of adults over the age of 65 take an over-the-counter analgesic at least once a week. I think that that's very significant, and it also sheds some light into who our typical users may be. It gives you a little clue. And yet another good quote out of the book, over-the-counter analgesics account for almost a quarter of the adverse drug reactions reported to the Food and Drug Administration. To me, this suggests that there is a correlation between the accessibility and the widespread availability of getting these products, and then all of the reactions that are as a result of having such a large access of these products, being that it's so easy to obtain it. And it's available for a variety of ages. You know, you can get it you can use it for infants all the way up, well beyond senior citizen age. Okay, so just a brief history in general, at least 2,000 years ago, people have used plants to treat different types of diseases, more notably the willow tree. There was a chemical in a willow tree called salicin. It was used to relieve pain. The book gives an example of women who were in labor. They would chew on the bark of the willow tree to help with pain and to also induce labor. Of course, it had a bitter taste, and there were some other reasons for looking for other options. The book also gave some other options or some other reasons for alternatives, such as gastric discomfort and limited availability, you know, having to chop down so many trees just for the bark, different things like that. So it led to scientists and doctors, you know, they started looking for some other options. And they turned to opium, and of course that resulted in other issues and other side effects. So they reverted to salicylic acid, which is a cousin to salicin. It's easier to produce. You can find this in fruits, vegetables, and of course in willow bark. Nowadays, you would see salicylic acid in in items such as shampoo and acne medication, for example. And then another alternative to salicin was acetylsalicylic acid. It's also known as aspirin, and it was introduced by Bayer Pharmaceuticals in 1897. And this was promoted as having less intense effects. And aspirin has been around for a while, so obviously it was proven to be effective, and it's obviously convincing seeing that it's still around. And I have just another quick breakdown of the historical timeline of the over-the-counter medication. So of course it went from salicylic acid all the way to acetylsalicylic acid, and more recently into the propionic acids. So what we would refer to as naproxen or ibuprofen. And so this timeline also shows you that the term over-the-counter analgesic, it's still a new term, being that it was just introduced in the 50s. So again, the 4 types of over-the-counter analgesics, you have aspirin, acetaminophen, ibuprofen, and naproxen. All right. And just a quick breakdown, in general, the speed of absorption once you ingest the medication, it's anywhere from 15 to 120 minutes. It really depends on whether or not you have a full stomach or not. Of course, if your stomach is empty, it will absorb into your bloodstream much quicker. And then your initial relief would be in a matter of 3 hours. And the relief of pain would last between 8 to 15 hours, depending on your tolerance and how long you've been taking the medication. And I just thought it was interesting that over-the-counter analgesics were, if taken, depending on the amount taken, it could equal the same intensity and the same feeling and the same effects as would some stronger medications such as Demerol and codeine and other types of narcotics. So it's also, it could be a reason for abusing the drug if you want to get those type of effects. Another good quote, more than 77 million pounds of aspirin are manufactured and consumed each year in the United States. Another indicator of aspirin or over-the-counter pain medication, that's yet another indicator of its impact. And it's a good sign that it will be here to stay for quite some time. And of course, aspirin works by dilating blood vessels throughout the body, which reduces fever. All right, so aspirin typical users are those chronic pain sufferers, those with joint issues, chronic disease management, people with situations such as diabetes, rheumatoid arthritis, just to name a few. So of course, the typical user would look like an older adult over the age of 65. And again, it controls inflammation and swelling and control mild to moderate levels of pain. So other users could be women going through in the premenstrual periods. They could use the medication as well. And then it reduces fever. So another typical user would be children, infants and children. And it works at the area of injury and at the brain, so in 2 different places. And aspirin also stops prostaglandin from producing, which is responsible for inflammation as well as inducing labor. All right, so these are just some quick facts about aspirin with the dosage. I already went over there on the previous slide, so move on. Acetaminophen, it's an alternative to aspirin. It's also known as Tylenol or Advil. It's a little more popular in the recent years. And the dosage depends greatly on weight, but generally it's suggested that you take no more than 4,000 milligrams a day for no more than 10 days. And it is very harmful if taken with alcohol, seeing as though acetaminophen has a toxicity, high toxicity rate for damaging the liver, and alcohol does as well. So combining the two would obviously result in a quicker decline of the liver. And of course, it works similar to aspirin. And ibuprofen, its street name, or also known as Motrin or Advil, it has a higher risk of kidney and stomach damage, and it's counterproductive with certain medications, certain mood medications. It's not productive with it, and as well as with blood thinners, certain hypertension medication, and certain diabetic medication, which would also put adults, again, over 65 years of age at a greater risk of using the medication. All right, and naproxen is better known as Midol, Sudafed, or Aleve. It's used to treat mild aches, pains, and swelling. With this medication, you would only need to take one tablet every 12 hours. And going back to these special population concerns, these are the warnings if problems in the following area exist. If you already have issues with your kidney, liver, heart, mainly with your main organs, or respiratory issues, then you would be at risk for harmful effects of the medication. And of course, adults with, or individuals with compromising health and immune systems. So we're again talking about the aging adults, and we're talking about pregnant and postpartum women, seeing as though the medication enters through your bloodstream and it can be passed on to your child. So it goes through the bloodstream as well as through breast milk. And then again, with children and infants, due to the weight of children, you have to be careful with that as to not accidentally overdose them. And then here are some more facts about toxicity with the over-the-counter pain medication. And again, some signs and symptoms of overdose with the medication. And you can see that these side effects are similar in some cases, and in some cases they're not so similar, but you can also see that a lot of the signs and symptoms of overdose may look like other conditions. So I'm kind of picking on the older population a little bit, but just certain symptoms and characteristics, such as altered blood pressure levels and seizures and unexplained confusion and blurred vision, different things like that could look like a stroke when in all actuality, it would be a sign of an overdose. And then in looking at treating an overdose, you would see that recovery is much more likely with ibuprofen and naproxen, as opposed to acetaminophen and aspirin. If you notice, with aspirin, the treatment for an overdose is much more intensive. You would have to have a gastric lavage in some cases, which is stomach pumping. In other cases, you would have to have alkaline diuresis, which is essentially a fluid being pumped into your body, into your kidneys, to force your kidneys to make you urinate so that you can reset your pH balance, reset your alkaline levels and all of that, and also all the way down to a ventilator or intubation. And this is a good indicator that bouncing back from an overdose of aspirin is less likely than would be the other medications. And these are my references. And that is it. Thank you so much.